In the spring of 2026, the MV Hondius, a Dutch-flagged expedition cruise ship operated by Oceanwide Expeditions, became the focus of international headlines. The ship was stranded in the Atlantic Ocean after an outbreak of a rare and deadly virus was confirmed on board. The virus was identified as the Andes strain of Hantavirus, a pathogen carried by rodents and notable for being the only hantavirus known to spread directly from person to person. The outbreak aboard the Hondius was unprecedented in maritime history and required swift coordination between multiple countries and global health agencies. The Hondius is a polar-class vessel, built to withstand icy waters and navigate extreme climates. It had departed from Ushuaia, Argentina, on April 1, 2026, bound for the Canary Islands, with scheduled stops at South Georgia Island, Tristan da Cunha, and St. Helena. On board were 147 passengers from more than 20 countries and 72 crew members. The demographics reflected the international appeal of expedition cruising, with travelers from the Netherlands, Switzerland, South Africa, the United Kingdom, and other nations. The voyage was expected to be routine, but within days it became the site of a serious health crisis. The first signs of illness appeared on April 6th, when a 70-year-old Dutch passenger developed fever, headache, muscle aches, and mild diarrhea. These symptoms were non-specific, resembling flu or food poisoning. By April 11th, his condition had worsened dramatically, progressing to respiratory distress, and he died aboard the ship. His wife, who had been traveling with him, also became ill. By April 24th, 2.5 weeks after her husband's symptoms began, she fell sick shortly before disembarking at St. Helena. Her condition deteriorated as she attempted to fly home, collapsing at Johannesburg Airport. On April 26th, she died in hospital. Test results confirmed she too had hantavirus. Health authorities began contact tracing, investigating her interactions on the ship, in airports, and on flights. This was the moment investigators realized more passengers were about to report symptoms. On April 25th, the same day the wife left the ship, another passenger presented with fever and shortness of breath, showing signs of pneumonia. He was evacuated to intensive care in South Africa, becoming the third confirmed case. That same day, a fourth case was reported, also with pneumonia, and this passenger died. Soon after, at least 4 more suspected cases emerged, including 2 crew members. The ship's doctor and health authorities tried to contain the outbreak by confining passengers to their rooms. The Hondius was quarantined offshore for 21 days while investigations continued. Ports refused docking permissions, fearing the ship might be both a carrier and a source of infection. The virus identified was the Andes strain of Hantavirus. This strain is most often found in Argentina, which is significant because the original couple had spent time there before boarding. The Andes strain is unusual because it is the only hantavirus known to spread between humans. Typically, hantavirus infections occur when people inhale viral particles from dried rodent droppings or urine. In this outbreak, however, close contact between passengers appeared to have facilitated transmission. The virus infects the lining of blood vessels, and in severe cases, the vessels in the lungs become leaky, flooding the airways with plasma. Patients experience rapid respiratory distress, and death can occur within 24 to 48 hours of onset. The incubation period for hantavirus ranges from 1 to 8 weeks, complicating contact tracing. Authorities had to consider multiple possibilities: that all passengers acquired the virus from rodents on land before boarding, that the original couple contracted it in Argentina and spread it to others on board, or that rodents on the ship itself were carrying the virus. This uncertainty led countries to refuse docking permissions, fearing the ship might be both a carrier and a source of infection. The outbreak was classified as a cluster event rather than a widespread epidemic, but its occurrence aboard a transoceanic vessel raised concerns about the potential for international spread. Passengers described the experience as frightening but also surreal. They were confined to their cabins, uncertain of the risks, while news reports portrayed the ship as a floating quarantine zone. Travel bloggers on board documented the beauty of South Georgia Island, the penguin colonies, and the dramatic landscapes, juxtaposed with the sudden onset of illness among fellow travelers. These accounts helped reconstruct the timeline of the outbreak and provided insight into the human dimension of the crisis. For those on board, the outbreak was not just a headline, but a lived reality, with fear, uncertainty, and grief. Clinically, Andy's Hantavirus infection progresses quickly. Early symptoms include fever, fatigue, muscle aches, headache, and gastrointestinal upset. The disease can escalate to pneumonia, acute respiratory distress syndrome, shock, and multi-organ failure. The mortality rate for Andy's Hantavirus pulmonary syndrome can reach 50%. On the Hondius, patients presented with fever and respiratory symptoms that quickly escalated to severe pneumonia. The confined environment of the ship and the delay in accessing advanced medical care contributed to the severity of outcomes. Some passengers required intensive care, intubation, and ventilation support. There was no cure, no vaccine, and no antiviral treatment available. Care was supportive, focused on maintaining oxygenation and stabilizing patients. The international response was swift and coordinated. The World Health Organization issued situation reports, coordinated communication between countries, and provided technical guidance. The Africa Centers for Disease Control and Prevention assisted with contact tracing, laboratory testing, and port health services. South Africa's National Institute for Communicable Diseases confirmed cases and provided treatment in Johannesburg. Switzerland treated one patient in Zurich and reassured the public that the risk was low. The United Kingdom Health Security Agency monitored British nationals, arranged repatriation, and enforced isolation protocols. The Netherlands and Spain coordinated docking permissions, medical evacuations, and repatriation logistics. This multinational effort demonstrated the importance of global health governance under the international health regulations. The incident also highlighted the logistical challenges of managing medical evacuations from a ship at sea, requiring coordination of aircraft, port authorities, and specialized medical teams. The outbreak also raised scientific questions. Researchers studied the transmission dynamics, incubation periods, and clinical outcomes of Andy's Hantavirus in this unique setting. The incident provided new data on how the virus behaves outside its usual endemic regions. It underscored the importance of surveillance for emerging infectious diseases and the need for rapid diagnostic tools. The outbreak became a case study in medical schools and public health programs, illustrating the challenges of managing infectious diseases in confined environments. The incident encouraged collaboration between virologists, epidemiologists, and public health officials, leading to new studies on the genetic characteristics of the virus and its potential for spread in non-endemic regions. The Hondius outbreak demonstrated how quickly a rare pathogen can become a global concern when it emerges in the context of international travel. It showed the importance of preparedness, surveillance, and cooperation. It also highlighted the need for cruise operators to invest in medical capacity and emergency protocols. The incident prompted reviews of health measures on ships, discussions about port health policies, and renewed attention to zoonotic diseases. It also raised questions about the adequacy of medical facilities aboard expedition vessels, the need for rapid diagnostic tools, and the importance of training crew members in infection control procedures. Passengers' experiences were documented through social media posts, blogs, and interviews. These accounts provided a human perspective on the outbreak, showing how individuals coped with confinement, uncertainty, and fear. Some passengers recovered, showing improvement, but others required intensive care. The outbreak was not just a medical event, but a social and psychological one, affecting the lives of everyone on board. For many, the experience was a reminder of the fragility of health in the face of emerging infectious diseases. The Hondius outbreak also had implications for international travel and tourism. It raised questions about the safety of expedition cruises, the responsibilities of operators, and the role of governments in protecting public health. It showed that even rare pathogens can disrupt global travel, and that preparedness is essential. The incident prompted discussions about insurance, liability, and the future of cruise tourism. It also highlighted the importance of transparent communication, both to passengers and to the public, in maintaining trust and preventing panic.